Well, good afternoon to my Heart2Heart Doctor Telemedicine group. I'm going to talk about a pacemaker. A lot of people have been asked about what happens when you put the pacemaker in and you sign a consent form, and you may have some discussion in clinic, or you may be given a booklet on it. But what I've got is the heart opened up here, and the right atrium, the little chamber there, has been exposed, and this is the right ventricle, and this white thing is the tricuspid valve with the little papillary muscles or guide ropes. And normally the heart sends a message from the top down through this septum with fast fibres called the bundle of His. So when a signal comes from the top, it passes down here to the bottom. The heart makes this right ventricle and left ventricle contract synchronously. But if you've got heart block or you miss beats, this needs fixing with some hardware, and so we use pacing techniques. So I've got here a wire. This is a pacing wire, and you can see it's got a tip. Some of them have grappling hooks. This one has a little screw in the middle, which if you twist the other end a few turns, it will come out and enable it to grip the lining of the heart. You can see this wire in the middle of it. This stiffens the tip, so when I push it right down, this tip is quite stiff. When I move it, it's soft, and that allows you to manipulate this wire in the heart. So I'm just going to pretend we're putting in a pacemaker now, and we can't go through the blue one because it's a solid tube on this model, but we'll pretend we've gone through it into this right atrium. We get in under the collarbone, and we want to get through that valve. So I want to push it down, and this is done under X-ray screening, and I'm going to have to tip it up and have a look, because it's not the same as doing it in real life. And what we're trying to do is get this wire. I just hold it with my teeth just to get this to move round, and now you can see this little wire is starting to appear. So what you want to do is get it to sit in one of these grooves at the tip of the heart, the right ventricle. So let's try that, and there we are. We've got a nice position there. That wire's there, and we can test it. So you can see it sitting there, and we'll test the electrical circuit by external connection to a box, measure the electricity coming to it, and see if it will trigger the heart, and then get the patient to take a breath or cough, and if it doesn't move, it's in the right place. If it's a screw-in lead, you'd unwind that top end to push the screw in, make sure it's connected. So that's sitting there, and then this lead, which is coming out through this vein, I'll just tuck behind here, is still outside the skin. So it's going through the vein into the heart, and it's been checked and it's in the right place. It's nice and stable. In fact, that one's just moved, so we'll have to move it back, and that can happen. So you find a better spot that doesn't slip, and you put it in. So that's a single chamber or a ventricular pacing VVI, but we're going to have two leads now. So we've got this other one. Now this one starts straight, but if we push this curved wire in, it goes curved, and you can see it's curved now. And the reason for that is you want to get into this chamber and point upwards to where the sinusoatrial node is, where the pacemaker signal comes from. So if it's producing one, you can sense it, and if it's not producing one, you can pace it. So we'll put this just out the way through this way so it doesn't come out and fall off the model, but it'll go through the same route, but through the vein, down the blue bit, and this time it's got to go in here and point upwards. So if we look at that, you see how it's pointing upwards. So you've got to pull up until it catches, and then you adjust the top end, and when you're happy it's holding firm, and it can be difficult on a solid model, but we're just going to assume that's going to sit there. So now what you've got one pacing wire has jumped out, so we have to reposition it. Well, that can happen, but it doesn't happen like that. So now we've got two wires. We've got the one in the first one we put in the ventricle, and that's got to go through again. There we are. So we're going to give that a good spot, get it gripped nicely, and if we can get to where we were, we'll retest it. If it does move, you have to retest it all. So I'm just going to put it in. There we are. It's come in a big curve, and we'll pull it back, and we'll just try and get the right spot. So it's fiddling under X-ray screen, and we can see this tip moving around on the screen. And we have to cheat a bit now because it's difficult to do with hard tissues like plastic and the real one. So we'll just get back to where we were with one in each chamber. So we've got the one in the bottom chamber, bottom of the right ventricle here, and then we've got the other one that's going to sit at the top. So now they're nicely in place. The patient's had the checks electrically done. You get them to take a deep breath and cough, and check they don't move. And when you're happy they don't move, you put some stitches at the top so they can't move. But then how do you get the connection between the two? Well, you take these wires out the top, and for the sake of ease, we're going to take these out on one of them, because I've got a pacemaker. So this is a pacemaker. This is a single chamber one. It's got one hole, but imagine you've got two holes. They've got screws in the top, and once you've taken the wire out, this will slot into here. You screw the screws up, it won't pull out, and then you've got a pacemaker, and that then is still coming out the skin, all this extra wire. So this is in place in the heart, as we showed before. This wire is coming out through this vein under the collarbone, about here. So what happens next, if I show you on me, so you've got your pacemaker wire in there, it's coming out the skin here, and there's the pacemaker flopping around, but you've made a pocket here under the skin with local anaesthetic, and you tuck this into the pocket, sew it up, all under sterile conditions, you don't see it. And that's a pacemaker, and you'll have one lead, in this case, which we've got here, going to the bottom. And if it's a two-chamber one, as we showed you, with a curved lead, we'll have to put the curved one in with the lead, and I'll just show you how that would look. So we'll just put this bent wire back in, just to give the shape. If I can see it well enough, there we are. So when you do an X-ray to see the position, you'll see the curved one pointing up like that, inside the heart, and you see the straight one pointing to the tip of the right heart. So you've got them in this fashion as I've shown you here. So that's what happens when the pacemaker goes in. So I hope you found that interesting, and how a pacemaker is put into the heart in the model that I've shown you. And I'll be doing a Facebook Live on this topic in the near future. So feedback will be welcome when I do this. Cheerio.